Hey, welcome everybody. I'm alongside of Dr. Wayne Scott Anderson, New York Times best-selling author, and today we're going to facilitate a little Q&A with him. Dr. A, we're live on Facebook, and we're excited to get a chance to hear a little bit more about some of the insights that you have in these challenging times that are going on right now, just to reassure people that they have a lot of confidence in healthy living and actually thriving in challenging times.
Great. Thank you, David. And it's great to be here. And, just a little bit about me, if you don't know me personally, is that I'm a physician. I've been a physician for now way over 30 plus years. Originally was a critical care physician. And in the last 20 years, I've kind of changed my focus in helping people create optimal health and well-being and helping people have the opportunity to kind of take charge of their life. And it's led to us creating an amazing community, an amazing group of coaches and leaders. And I've written a transformational system that gives you step by step what's necessary to change your health and your life. And so I thought today, so many physicians are working so hard. They're on the front lines. And obviously, I get all the medical literature and I have an opportunity to daily review it. So what I wanted to do today was just come on because I do understand people and I work very closely to help people improve their health and take responsibility and kind of be in control, take the locus of control back for them. So I feel like I'm properly trained and have the experience to maybe hopefully help give a little perspective to this day and time. So we know a lot about it and we know a lot of things, but a lot of it is misinformation. It's created fear and hysteria. And so I just want to kind of put it in perspective as a physician talking to you individually about what we can do. And the most important thing we can do at a time like this is make sure we're not over worrying, that we're not panicking, we're not fearful, and understand that with reassurance, there's some things we can do to help be part of the solution rather than part of the problem. So I just want to kind of start there. So we talk about flattening the curve, and I just want to give a practical update on what that means. That is that the nature of this virus, COVID-19, which is a coronavirus, and it's called a coronavirus because it has a little under the microscope, like a little crown on the top of each virus. So it's part of a family, and it's a whole family of viruses. It can be as simple as a cold, a common cold. There's some that are in the pet species and in animal species, and then there's this novel COVID-19, which started in December in China, and now is spread because of its novel nature and because it has some characteristics that kind of keep it in a stealth mode. So it has an opportunity to infect a lot of people in a hurry. But the reality is, for most people, for 80% of people, it usually is very mild. In fact, they're finding that many people may actually have been exposed to it, infected, and have no symptoms at all. And so that's good for the virus. It's good that in whole that most people aren't going to get real sick. But it's also bad in that the virus can now extend itself. And what we don't want to do and why we want to spread out the virus is because if the virus has its normal course, it will go quickly and peak and go through the whole population, much as it's done in China and in Italy. And it can overwhelm the medical delivery system as it has in Italy. So in the United States, we want to be ahead of it. And so that's why the government and facilities have canceled the events to get us out of groups so that there's less likely that the virus can be contagious and spread to a whole bunch of people at once, which then would go back to their natural setting and overwhelm their communities in a hurry. So really the most important thing we're doing is we are preventing this virus from getting out so rapidly that the people that are high risk, which I talked about last week, who have potential to get sick, especially the people that are immune suppressed and that are older, and they may need to have hospital facilities or at least some acute care. We don't want to overwhelm that system. And also, as the heroes, and I have to applaud our physicians that are in clinical practice that are out there every day in the battle lines, helping take care of those patients, so we don't overwhelm the system. So that's the general thing we need to do, specifically in the United States. But it needs to be done in all the countries of the world with this pandemic. So the first thing is that we need to know what do we really know, what's factual and what's not, because the most important thing we could do at a time like this is be knowledgeable so we can help be part of the solution, but also be calm that what we can do, and if we take control and can do those things, we're more likely, David, to be able to keep the virus from spreading so rapidly that it can overwhelm our ability to take care of those people that do get sick. Does that make sense?
That's very clear, Dr. A. And, there are a lot of people that have some strong physical concerns, but maybe speak to the mental concerns. You speak a lot about developing a healthy mind. Maybe you could share some of the strategies that you're encouraging people to take on in challenging circumstances where there is a lot of stress and a lot of unknown issues that are surrounding our lives.
Yeah, and it's so important. As I've studied, as I mentioned, as I went from really physical medicine, working in the intensive care unit, to being out in the public, evaluating why do people suffer in both their physical health and their mental health. A lot of it is emotional mismanagement. It's that we don't know how to respond when something bad happens, and it's so important, because one of the most important things you can do individually to protect yourself and protect your family is to build that calmness, that psychological support that can help people, discuss their fears with somebody they trust and are knowledgeable, but also can be in position to feel relatively secure by doing the things that we're talking about. So let me just start with the physical things. When we isolate ourselves into small groups, being with our close family members, I have my girls are here with me. And they have a couple of friends, and we've kind of sequestered ourselves, not fully. I mean, we still go shopping and use common sense and hand washing and all those things, but we have a smaller group that kind of support each other. And it's nice because they feel comfortable being, obviously with their father. And they know that they're going to get the best advice. And by being together, it's important because it gives us some psychological security that, number one, we're isolated from going out and being exposed in our community. Some places the virus has gotten into, and a large amount of people have been exposed. And there's some places that haven't been exposed yet. But what we want to do is, before it becomes widespread, we want to get people isolated, not isolated, but actually just kind of put in a position where they're kind of guarded at home, not out in public spaces. And that's where the government, took a little bit in the beginning because there was lots of confusion, but now that's why almost all events over 10 people have been canceled, because we don't want a lot of people to get together. But so from a psychological security, the first thing you do, what can you do? And I talked about this last week, right when this started happening, before anything was canceled. The most important thing individually we can do is, number one, is wash our hands, and wash our hands every, and I actually did a little video on how to wash your hands, but 20 seconds, soap and water is the best, even better than hand sanitizer. If you don't have that, great. You can use, can't wash your hands, and you can use hand sanitizer to be 62% alcohol, so it kills the virus. But hand washing for 20 seconds with soap, not using foam, but using a regular liquid soap, is the best way to start, because it takes that out. When should you do that? Well, you should do it certainly anytime you cough, you touch your eyes or touch your mouth, anytime before you eat and after you eat, if you use the bathroom. And if you feel like you're in an environment where you're going to touch something external, then that's great to use the hand sanitizer. And we're finding that the virus seems to have a proclivity for metal and hard substances and less for soft materials. So, like your doorknobs or moving in and out, going using a restroom, any of those times you, of course, want to wash your hands, because that's the most important vector. Now, we think the virus is airborne. And so that's why we want to keep people, if you do go out, is stay 6 feet, because that's kind of the range. But knowing that, we want to minimize as much as we can being exposed to groups of people. So that's the thing. Now, from the real pure, what you're really asking, the psychological, is we can stop, challenge, and choose every time we start feeling that anxiety. And so that's a really good time for us to connect. If we have family members that aren't together, wow, connect with them. The people you care about and have rapport, your friends and your close family and your spouse, your significant other, man, spend time together. This is a great time to support each other, to listen to and discuss, but to do it based on the facts. And I'm going to talk about some of the facts that are important with the COVID-19, just a moment here. But does that make sense, David? So, if we can just kind of let those anxieties and stuff kind of, be aware that this is a serious problem. We want to do our part to both help support our family, people we care about, but also eliminate. So one thing you shouldn't be doing if you're home is watching TV all day long or watching the internet. The updates will come. You certainly, by the way, the three best probably are the CDC, the Communicable Disease Center in Atlanta, has a great website, cdc.gov, where you can get the latest things that are going on. You've got Johns Hopkins, which has a wonderful, marvelous site. You have Live Science, that's great, and those are really the resources, and also the World Health Organization. So you can pick one that you like the way you can navigate it, and they'll update. And also, if you're in a community in a state, you can go to your local state government, and they kind of show you where it is. And obviously, one thing you want to do is avoid where the virus is, where it's replicating itself rapidly. So that's the second thing. So I think those are both. So isolate ourselves so we feel more secure. That's the thing we can do. Use proper hand washing. Obviously, if you do cough into the cranny of your elbow, and then basically, other than that, just stay cool. Here's the other part. 6 of the 7 people in China, which is the biggest experience, that were infected, showed minimal symptoms. So most people won't show symptoms, and we're going to see, what is the mortality rate? That will go down as we learn to test better, because there's a lot of people that feel like they have a mild, really mild cold, or maybe no symptoms at all, that are being infected, that the virus is not. So that mortality rate, which seems higher, we're finding. And also the good news is China is already starting to show recovery. They have something like 60,000 cases of people that are back, that had the virus and were sick and are now healthy again. So, we're at a place where we just need to realize that we want to slow down the spread of the virus, so the people that are affected and do get sick, which are really the elderly and people that have immune suppression, that those people aren't exposed. So that's the second thing. And then the third thing is, if we're in the community, if we're in our community and we're a coach or a client, so let's support each other. Let's be there. That's why hopefully this is helpful and can be a little calming, because there's so much information, so much misinformation. Like, I was reading in the CDC where people were recommending things like gargling with Clorox. My gosh, acetic acid, vinegar, none of those things work. In fact, as far as boosting your immune system, I talked about it. What you want to do while you're home is you want to eat healthy, lots of fruits and vegetables. You can get your vitamin C from there. And, there's no studies to show. There's some studies done on the cold that vitamin C may stop a common cold by, maybe the symptoms by a day or so, but it's not going to hurt you. You can get the vitamin C in fruits, eat lots of fruits and vegetables, or you can take a supplement, like a 500 milligrams a day. It won't hurt you unless you have kidney stones. But it's certainly something that I'm doing and having recommending to people that ask me. I'm personally doing it because it's not going to hurt, and it gives you a little bit of potential, maybe help. We don't know that. But beyond that, so eating healthy, stay away from fried foods, sugar, stay away from alcohol, obviously medications. You too should take your medications. We want to get activity, go for walks if you can, as long as it's not in a crowd, less than 10 people. You should stay active. I said, don't stay on the TV too much, get up and move around, play games, hang out, have some fun, watch some, a great thing to do is watch funny movies. I just saw that Sling, one of the other things, is allowing free channeling right now. So if you're going to use the TV or play games with the family and do things where you can have fun. Laughter is a great way to boost our immune system, David.
Yeah. Cheryl's got a question from Facebook Live that wanted to know more just about dealing with fear. And I know that you talk a lot about this word social distancing as not being your favorite term, but you really like the idea of physically distancing, but staying socially connected online and in different environments. Anything
Absolutely.
that you could share about?
Yeah, it's critical. It's important as humans. 10,000 years ago, and I base a lot of this work I do currently and recommendations for people based on how we were designed. And 10,000 years ago, we would get together in a fire at night after working and doing whatever our part was with our tribe, and we'd sit there and talk about our great hunting ability, or how we cooked, or what we prepared, or what's going on, or talking about life, or looking up at the moon and philosophizing. But the reality is that connection, that's social. We are social animals, and when they say social distancing, I just want to make sure that's not isolation, because social distancing, what they're actually talking about, all the things we talked about, which is physical distancing, where we're physically separating, we're stop group meetings, we're getting ourselves relatively isolated and only going out, to go to the pharmacy or to go to get groceries, staying away from public gathering places, staying 6 feet apart, even in, if you have someone that has symptoms, basically having them quarantine themselves. And but basically mental connection. This is the time of connectivity with people we care about, that we love and trust. Love, but whether it's basically romantic love or agape love, where you're helping other people, just by sharing positivity from the standpoint of what we can do, what that does is that gives us reassurance. It allows it to be factual, because the unknown, it's this fear of the unknown. What does this mean? What are the chances of me getting infected? What are the chances? And by the way, over this next period of time, a lot of Americans are going to contract and be exposed to the virus over time. The idea is to slow it down, so that if someone is at high risk and they do get sick, we have the facilities to take care of them, so they too can get through this. So that's kind of part of, at the biggest level, like the big tribe, the United States of America, coming together, whether our ethnicity or our race or, all those things don't matter. Everybody can contract this virus. And so it's a time for us to come together and support, our fellow Americans and our fellow citizens of the world. So that part's important. So if you know the factual information and not the hysteria, bottom line is then you can act in an accordance way, which is to physically isolate but mentally connect. And so that's kind of why I'm doing this day. One of the things, just to give people a modicum. Now listen, these are not medical claims I'm making. I'm simply responding to the literature that's done by the experts. I'm not an epidemiologist, infectious disease specialist, but I certainly am knowledgeable in medicine of the things they say. And so I'm able to maybe convey that in a fashion that gives a little balance to it. Unfortunately, sensationalism on TV and the news stations is running rampant, and everything is, they want to be the latest that says something, and they're not necessarily really getting it validated with science. And so that's kind of today, David, I'm just trying to put in position for those folks that are part of our community, and that we can reach out to the people in our communities that care about each other, and kind of give a balanced approach that as fellow humans, this is a time for us. We have an adversary. It's a virus, and it's a worldwide pandemic, not just an epidemic in one little area. It's a pandemic that's going to affect this whole planet. And here's a time when we can use technology to communicate and to create balance. And then individually, the mental connection that you asked me about, David, is so important. So make sure you're daily reaching out. If your family's isolated from you and the people you love and care, reach out and call them, reassure each other, maybe turn them on to this video that, this too will pass. And it's a great opportunity for us to stand up. I've talked to the leaders before, but there was a great movie by that Tom Hanks, who, by the way, did a great piece the other day, very beautiful piece when he was interviewed. But Tom Hanks in Apollo 13, basically Ed Harris, who was the command center in Houston at the time when the Apollo 13 had blown up part of it, and they didn't think they could get home. Everyone's saying this is going to be the worst disaster, and Ed Harris stood up as the commander of Houston and said, "No, this is going to be our finest hour." So this is just like when 9/11 happened, which was changed the world forever. It changed the world, but people came together, and I believe that same thing will happen now, because people as a whole are good and they want to help each other, and we have an opportunity to stand up and help each other at a time like this.
That's great. Well, as we wrap up here today, Dr. A, you have been so generous with so many resources on the habitsofhealth.com website. Underneath the system resources tab, there's over 70 exercise videos that you've published for people that are maybe locked out of their gyms, or they cannot access, the places of exercise or fitness that they're going to. Maybe you could just talk a little bit about some of the resources that are available, like the health assessment, just for people maybe that are wanting to improve or sustain their health right now. What can they get from you for free in terms of resources?
Yeah, great. Well, thanks, David. And I hadn't thought about talking about that. Thank you for bringing that up. But it's kind of like I was reading on the today when I was looking at things you can do in your home, like clean out your closet. Well, the most important thing you could do today is make a decision that while you have more time, and if you're not at work, or even if you are at work, how do I improve my health and well-being? Because as I mentioned, a lot of Americans are going to end up contracting the virus. Whether you get sick or not depends on how good your body is at fighting off the virus. And so if you start today working on your health, first of all, it gives you a great thing you can do. You can actually start having control. You know, the unknown of the epidemic, you can't control who's going to get infected. We can help through physical distancing. But the reality is, we know this individually and for our family, if we're cooking better foods, if we're exercising more. So the habitshealth.com site is a free site. I set it up as a support site for people that are interested. But you go to habitshealth.com and you can take a health assessment to see in the 6 key macro habit areas how healthy you are, and it'll kind of help you decide maybe which one you should be working on. Maybe you have one that's lower scores than the other, and you can work on that. And that'd be a great time to start working on it, because that might be the weak link. Because when over the last 2 decades, when we evaluated how do we create optimal health and well-being, there's 6 key macro habit areas that we can all have the opportunity to take back control, which when you take control and you can actually do something, helps really reduce your level of fear, because now you feel like you're doing something to help and you are helping. So in that, you can do the evaluation right at the bottom, and it does it digitally, tells you where you are in terms of your health and which ones you have the lower scores on, which is cool. And then you can then go through the resource. And you said, like, there's a whole bunch of fun things you can do from home, exercise things, activity things. It shows you how to pick better when you go to the grocery stores. You know, I saw the other day when I went to the grocery stores, my girls were coming. There was a guy taking like 4 shopping carts and loading it up with tater tots. You know, 4 things of tater tot. I'm going, oh my goodness, that's the worst possible thing. High glycemic fried food does not make your immune system work well. So it'll give you some guidelines there, activity guidelines, how to hydrate your body, which are all important to give the body the best chance, how to sleep better. Man, this is a big one. I didn't really talk about that earlier, David, but sleeping is so critical. And there's some great guidelines on the site about how to sleep better, how to be healthier, because when we sleep, it boosts our immune system. And when we worry and we get these cognitive motive loops where we're thinking and then we're feeling and we get anxious, that causes poor sleep. And with poor sleep, you don't get enough sleep, you lower your immune system. So yeah, it's a great resource. Hopefully some people that are reviewing this will, or everybody can use it, and it's for free. And we love you to, because the stronger we are, the stronger we can be for our community and for our country and for the world.
Yeah, they're good defense is an even better offense, and actually taking action on some of the habits that Dr. A's talked about can be good for us all. And so if this is the first time you've ever watched a video from Dr. A, be sure that you like the Facebook page for Dr. Wayne Anderson and get more updates like this. Dr. A is committed to continuing to provide free resources and education resources and videos like this to keep awakening the world to create optimal health and well-being in their life. So if you have any other questions, please post a comment in the comment section, or if somebody has shared this video with you, reach out to them, build a connection virtually and ask them for more resources and helpful tips, because there's plenty of tools that they can share with you. So Dr. A will close up the webinar now, and thanks again for joining us.
Yep. Just say one thing as we leave: be knowledgeable, make sure you're following factual sources, reassure yourself and your family, stay together, and this will be our finest hour. Thank you.